Hi students, I am going to go over your last assignment. So let's go ahead and dig right in here. We have case number 1. The patient's 17 years old, admit and discharge the same day. So you can see here on the 3M system, I have the admit and discharge same day. Make sure over here I have my APC finder, and then I have my outpatient for the group or the Medicare. Okay, so let's go right here. This patient here has tightness, cramping, increased bowel movements that do provide relief from cramping. Pain's more intense after milk or ice cream, also menstruating, but describes these cramps as different and worse. She's on no medication, no birth control, not sexually active. So here we have left lower quadrant abdominal pain, lactose intolerance, dysmenorrhea. So with this being, we're going to code all three. So let's go ahead and put those in. So we have Bill type 1 hospital outpatient. So it's going to be number 1 right here. Primary diagnosis, I'm going to go with the lower quadrant pain. So that's in, we have that. We're going to go ahead and then just add the other 2 diagnoses. Once again, you did need all 3 of these. All right, and then I'm going to put in the next one here. So we have N94.6. All right, so with that here, I have all my diagnosis in. Let's go ahead and look at the APC for this. Keep in mind, I'm looking for the APC. I need to put in the E&M service, which this one gives it to us. So I'm going to click Add Procedure, 99283 for my ER visit. All right, so now my APC pops up. So with that, my APC, as you look right here, at 05023. All right, so my next question for case 1, for the encoder, what's the estimated total reimbursement under Medicare? So with that, right down here, it's going to be $251.97. All right. So case number 2, we have a male, age 12. So let's go to next patient. Flip that to 12 or to male, age 12. And the date we're looking at is 9/7. Just going to go in here and switch that to 07 for both, admit and discharge, same day. All right. Okay, so this patient here had chest pain, and they presented the emergency department with the chest pain, pulmonary infiltrates, sickle cell disease. Treatment was aimed at reducing the chest pain. So after treatment and care, the patient was transferred to a larger children's hospital for admission for his sickle cell crisis and acute chest syndrome. A couple of different things here that we need to look at. Okay, so we're going to look at the diagnosis code. We know that the emergency department's a 99284. So right here, build type, I'm going to click number 1 again. I'm going to go ahead and put in my D7.01. That is going to be my sickle cell disease with acute chest syndrome. My APC, I need to go ahead and get in my emergency visit here, which is a 99284. All right, so with this, now that I have that all in, my APC is 05024. Okay, so let's go ahead and look at this. Per the encoder, the estimated total reimbursement under Medicare is over $500. Okay, so no, it's not. It's $396. So this is false. Let's move on to case number 3. A few of you had some issues with this one. And I think once I explain it, you will understand it completely. So we have a male, we have age 1, and admit and discharge once again the same day. So with this patient here, outpatient radiology for a TEE, echocardiogram for monitoring assessment of cardiac pumping without contrast. Okay, let's look here. It's a defect. They're evaluating the atrioventricular canal defect, which has been present since birth. Okay, so with that, primary diagnosis is going to be Q21.2. Okay, so I have my, keep in mind your Q codes are going to be congenital. So let's go down here. This is probably the biggest thing here. And what I'm going to do, I'm going to pull up, I do have the CPT book here, just so you can see the difference between the codes. Now you should have had 93315. A lot of you put down the echocardiograph TEE, but you put down, you look, they're very close. But what we're looking for here is for the congenital cardiac. Once again, this is congenital, so that's why we needed to go with the 1.5, not the 1.8. Okay, so go ahead and look at these two, look in your code book. We are all about going to the congenital cardiac abnormalities. So that's probably the biggest thing. Students, some of you missed that. So let's go ahead. I'm going to get in, add in that procedure, just 99318, 315, sorry about that. Okay, so we have, oh, I typed it in wrong. Let me back that up. Okay, so I have the correct code in now, 93315. My APC is 05524, level 4 imaging. And that really wraps up case number 3. So that's what we're looking at. So the biggest thing here was to have the correct CPT code. Okay, let's go ahead and to the next patient. Case 4, we have a 59-year-old female presents to the emergency department with passing melatonin stools. A couple of different things here. Okay, this is outpatient. All right, if you look down here, it says they do have melena, possibly duodenal ulcer. Keep in mind, this is outpatient. We cannot code anything that states possibly. That means they haven't done enough lab work or testing to code the ulcer, to code anything possibly. So we are going to have to just go with the melena as our code. So let's go ahead and change things around here. We have female, 59, and 93. We'll just leave the date here the same. Okay, we have hospital outpatient, number 1 again. So let's go down here. We have K. This is the only code you're going to have. I cannot code the ulcer because it's possible. Okay, so we have that. Looking here, let's see what our CPT code is. Case 4, we did an EGD, right? So that should have been 43235. All right, so I have all this in. I have my EGD in. My APC is 05301. Everything else, again, is all written out, so hopefully everybody got that one. Let's go to case number 5. Okay, a couple of different things with case number 5. So this here is a 73-year-old female. Okay, the biggest thing here is going to be the surgical area. Um, with the lymph nodes were removed due to location. The pathology report for the submitted skin showed clear margins. Patients discharged to home after 45 minutes in outpatient recovery. So let's go ahead and we are going to code that malignant melanoma of the left thigh first. I'm just going to go ahead and put in C43.72. All right, so let's go down here. Our CPT code, and I'm going to explain why it should be 14021. Okay, so we have an adjacent um, tissue transfer. Okay, so let's go through the CPT code 1402. We have the tissue transfer, which I just went ahead and put into the encoder. But with, keep in mind, so we have to go 2 centimeters. So that goes 2 by 2, which is 4. And then this area here is going to be over 10. So we have a good 14 total. So one thing you need to look at is make sure you go back to your CPT book and read through the adjacent tissue transfer rules. Also, remember that with an adjacent tissue transfer that you don't code the excision. That's included in the tissue transfer. So with that, go ahead and pull up. So our APC is 05054, and that wraps up this assignment. If anybody has questions, make sure you contact me and I can go over them.